Aloha, and good morning, good afternoon, and good evening. Welcome to the 7th session of the Adapting to COVID-19, Indonesia, the United States, and the Indo-Pacific Virtual Forum Series, Gender, Diversity, and Empowerment During the COVID-19 Pandemic, held with support from U.S. Embassy Jakarta and in partnership with the Center for Strategic and International Studies, Indonesia. This 9-part virtual series addresses broad, cross-cutting issues that impact both countries: emerging security issues, COVID-19, regional and bilateral trade and investments, and democracy and civil society. It features American and Indonesian experts with diverse yet complementary backgrounds to examine the trajectory of U.S.-Indonesia relations in the new normal. My name is Rob York. I am Director for Regional Affairs at the Pacific Forum. Please note that this session features simultaneous. You may access the English or Bahasa Indonesia channels using the globe on the bottom right portion of your screen. Our 6th and most recent session was on youth resilience to violent extremism. Key findings from that webinar included a saturation point, or a phase in which an individual faces a crisis of identity and therefore loses a sense of belonging to their social network, is a common youth gateway into extremism. Social bonds formed between individuals and violent extremist organization members also constitute a significant factor in the radicalization process. And finally, exposing youth to a multiplicity of ideas can create a space of doubt in extremist thought and help pull them away from extremism. Additionally, young people in the US and Asia should be educated and shown the consequences of extremism. The full key findings and event videos in both English and Indonesian will be available on our website in the near future. You can also view our key findings from the 1st through 5th sessions in the chat box now. Today's session will focus on gender, diversity, and empowerment during COVID-19. The 2016 Indonesian National Women's Life Experience Survey shows that 1 out of 3 women in Indonesia have experienced gender-based violence. A bill on sexual harassment and gender-based violence has recently been forwarded to the National Legislative Plan, while the Ministry of Health has issued gender-diverse sensitive textbooks. There has been more intersectional activism by gender-diverse groups, including in religious communities. For its part, the United States remains one of only 8 countries that has not yet ratified the 1979 Convention on the Elimination of All Forms of Discrimination Against Women. Stigma, intolerance, and violence against minorities are also all too common, but serious efforts are being made to champion diversity. COVID-19 has changed many ways in which those with diverse gender expressions interplay with various social forces. The mainstreaming of digital activities by means such as social media and web-based meeting spaces also continues to provide more opportunities to increase awareness on gender issues. This webinar will explore gender-related views in the 2 countries, discussing aspects such as health and autonomy, rights, and gender mainstreaming. Special consideration will be given to the impact of the COVID-19 pandemic on the rights and well-being of minority groups, and how their needs and perspectives can be better incorporated for inclusive post-crisis recovery and forging safe societies. Please note that remarks made in today's program are on the record, and a video and audio recording of this session will be made available on the Pacific Forum website and social media in the future. This event will be live streamed to the CSIS Indonesia YouTube channel. It will also be live streamed to the Pacific Forum Facebook page. Also a reminder to all of our speakers today, please speak slowly and clearly for the interpreters. I'd now like to introduce U.S. Embassy Assistant Cultural Affairs Officer Leo Jilk to give some brief welcome remarks. Leo.
Thank you very much, Rob. My name is Leo Jilk. I'm the Assistant Cultural Affairs Officer here at the U.S. Embassy in Jakarta. And good morning, everyone, or good evening if you're joining us from elsewhere in the world or the United States. On behalf of the Embassy community, I'm excited to welcome you this morning to a discussion about gender diversity and the whole range of issues that affect communities during the COVID pandemic on these issues and how we find solutions together. Unfortunately, sometimes gender discussions are seen as belonging only to specific members of the community, perhaps women or those who belong to so-called minority gender identities. In reality, discussing gender is important for all of us because no matter how we identify, we know someone, we love someone who has experienced challenges, unfair treatment, or outright discrimination or harassment due to their gender. Perhaps our mother, perhaps our sister, our partner, or our friend. So for that reason, it's very important that we continue to have these discussions and to help contextualize our own life experience as well as to empathize with the experiences of those around us. In the US, the Biden administration is proud to continue our commitment to the inclusion of various gender expressions into public discourse and in the workplace, and especially into the leadership of public and private sector institutions. In this way, we uphold the spirit of freedom of expression, but also a commitment to honoring diversity, which is the foundation of democracy, especially the democracies of the United States and of Indonesia. We are proud that our Vice President, Kamala Harris, is the first woman ever to serve in that office. This is inspiring, and it strengthens our commitment through our work at the U.S. Embassy in Jakarta to continue with programs and initiatives that improve equity among everyone, regardless of who they are, where they are, or how they identify in the gender spectrum. Our discussion today is held in the spirit of creating a dialogue on gender issues faced in Indonesia and in the United States, as well as specific challenges related to COVID-19, as well as the opportunities that come along with those challenges. A number of restrictions associated with the pandemic result in more time spent at home with family, with children and spouses, prolonged lockdowns, and the stress of facing uncertain economic and health situations. This has made this period particularly difficult, and women have been disproportionately affected. For those who have yet to reconcile their gender identity with traditional family values, the options, sadly, are often to live in isolation at great personal, professional, and financial expense. I do think there is a silver lining to the pandemic, which is the increase in the quality and intensity of digital discourse, which has opened up so much opportunity for activism and for the propagation of new ideas. In this way, communities separated by distance have grown more accustomed to using digital platforms to convene, create ideas, build networks, and establish solidarity across the globe. And I hope we're playing a small part in that process this morning. Finally, we're very thankful to have the passionate activist Anindya Restuviani from Jakarta Feminist and Hollaback, who we're also proud to say is an alumna of one of our professional exchanges programs here at the embassy. I want to also thank and welcome Dr. and social media influencer Alegra Wolter and Professor Joan Johnson-Fries, all the way from the U.S. Naval War College, to speak with us this morning. And also thank you to our moderator this morning, Rocky Intan from CSIS. Welcome back. Thank you for taking your time with us, and thank you all for sharing this morning with us. We hope the discussion will be fruitful for everyone, and enjoy the session. Thanks.
Thank you, Mr. Jill. For those just joining us, again, I am your MC for this event, Rob York of Pacific Forum. Rocky Intan from CSIS Indonesia will be moderating today's discussion, which will include feedback and Q&A with the audience. Later, participants joining through Zoom will be allowed to unmute their mics to ask questions or give feedback, as well as ask questions through the Q&A box. Participants' cameras are disabled throughout the session. There's also a survey link for our participants to fill out. The link will be accessible in the chat box at the end of the session. Now, for today's session, I will hand over the mic to Rocky Intan, researcher in the Department of International Relations at CSIS, to moderate the discussion and Q&A. Rocky?
Thank you, Rob. Good morning from Jakarta. Good evening to those in the US, and hello to everyone else in the world. I am very excited to moderate today's session. I was a panelist myself in the first session of this Pacific Forum series. We will first do the 3 presentations followed by a Q&A. The session in total is going to be 90 minutes. This is also a friendly reminder for the speakers to keep their presentation to 10 to 12 minutes so that we can have ample time for discussion and questions. For participants, you may also access the live interpretation feature using the globe icon located in the bottom right portion of your Zoom window. Participants are also welcome to raise their virtual hand or submit questions in the Q&A box during presentations. Now, going to our first speaker, we have 3 fabulous speakers. Our first speaker is Professor Dr. Johnson Fries. Dr. Joe Johnson-Fried is a professor of national security affairs at U.S. Naval War College in Rhode Island, having served as chair of the National Security Affairs Department from 2002 to 2010. Books she has written include Women, Peace, Security, An Introduction, Space Warfare in the 21st Century, Arming the Heavens, and Educating America's Military. Professor Johnson-Fried, you have the floor.
Thank you very much, Rocky, and thank you for inviting me to be part of this distinguished panel to talk about this very important topic that I think we are all quite passionate about. I am speaking for me tonight, for you in the morning, as a researcher and educator in the field of women, peace, and security, and the views I'm expressing are mine alone and not those of my employer. I'd like to focus my remarks on what I consider to be the interconnected links that serve as both structural and cultural barriers to women's empowerment, especially those that have been exacerbated by COVID-19. And I will focus my remarks on the United States. Before COVID, trends regarding professional women in the US workforce were trending in positive directions. Though women still opt out or leave the professional workforce at rates higher than men. The reasons for that range from everything from family matters, including not just childcare, but increasingly elder care for parents, to those associated with the workplace, feeling isolated, not having a mentor, feeling stalled in their position. But there were positive trends. However, based on 2018 data before COVID, nearly half of all American working women, about 46% or 28 million women, worked in jobs paying low wages, with median earnings of only about $11 per hour. The share of workers earning that low wage is higher among Black women at 54% and Hispanic and Latina women at 64%, rates much higher than among white women, which is about 40%. That reflects the structural racism that has limited options in education, housing, and employment for people of color. In short, COVID has been devastating for women. 1 in 4 women's employment has been affected by COVID, as opposed to 1 in 5 men. Almost half of working mothers in America said they took unpaid sick leave because their child's school or daycare was closed. That rose to 65% among low-income mothers and 70% among those working part-time jobs, most of the time not including benefits. Women were feeling more exhausted, more burned out, and more pressured than men because the family and career obligations that they struggled with in normal times were so much more intense during COVID. Some 40 million women likely won't re-enter the workforce once the pandemic has been brought under control. And as we've seen, we are still in cycles with the Delta and other variants. It's estimated that women leaving the workforce to assume childcare responsibilities will cost the United States about $64.5 billion annually in lost wages and economic activity. So the problem is at a national level, a community level, and an individual level. Many of those workplace issues relate to childcare. Even before COVID, childcare was found to depend on three factors: availability, access, and cost. And even prior to COVID, each was a big issue. Many childcare workers in the United States are not paid enough to be able to afford childcare themselves. Childcare in New York City and other large cities in the United States can cost, the average cost is $30,000 to $40,000 per child. I know that from statistics, and I know it from my two grandchildren, who my son and daughter-in-law have in childcare. In more rural areas, like the southern states, many childcare workers take the job in childcare simply because it's someplace they can work and provide and take their children for childcare at the same time to supplement their income, but at a very low level of pay. During COVID, every American mother found out that it was every woman for themselves, that there was very little backup. There was no backup plan. They were the backup plan. And reopening the schools is not an answer to childcare. There are many reasons for in-place schoolroom work, and I'm an advocate of that, but it does not in place of childcare. The economic downturn was harder on women than men. The COVID devastated industry sectors, especially service industries, where more women than men are employed. That includes restaurants, childcare, schools, hotels, all of the service industries. And not surprisingly, single mothers were hit the hardest. It is estimated that single mothers took the biggest brunt of the economic hit. Sadly, domestic violence has been a pandemic within the pandemic, especially during lockdown periods. When the economy collapsed, men out of work, the men that were out of work were feeling stressed. COVID doesn't make an abuser, but it gives abusers more time and tools to abuse their partners. In the US, police departments reported increases in cities around the country. For example, there was an 18% rise in domestic abuse in San Antonio, 22% in Portland, Oregon, 10% in New York City. One study reports that at Brigham and Women's Hospital in Boston, which is a premier medical facility, radiology scans and superficial wounds that are often consistent with domestic abuse rose between March 11th and May 3rd in 2020. They exceeded the totals for the same period in 2018 and 2019 combined. So not only were women out of work, they were feeling more abuse, the stress and the psychological factors were all compiled. Same-sex domestic violence rates were equal to or higher than heterosexual couples because the LGBT community members were more likely to be employed in highly affected industries, again, like education, restaurants, hospitals, and retail. That means higher stress and consequently a higher risk that the stress will explode into violence. Of course, the United States isn't alone in that. Those figures of domestic violence were common around the world. In parts of China, domestic violence increased by 300%, 25% in Argentina, 30% in Cyprus, 33% in Singapore, and 50% in Brazil, where ironically in that culture, women can be president, but are also subject to extreme domestic violence. Women in many countries are considered penalty-free targets. Police don't enforce domestic violence laws. It's too often ignored, and in some countries, they are even involved. If there's any good news in this, I would say that it's that problems which in the past were considered inconvenient and ignored have now come to light. I think it's important that the dialogue, such as we're having here today, makes it clear that childcare is not a problem for women. It's not a women's issue. It's a family issue. Childcare affects both men and women. It affects families. And if we can change the verbiage, if we can change the discussion and bring things like childcare away from being a women's issue and being focused on instead as a family issue, I think we'll find much more attention being given to it. As Mr. Jilk said earlier, the Biden administration is working to make sure that we move away from thinking of women's issues as a separate group of issues, and we see them as interrelated to everything we do. That's a hard thing to do. We've been enculturated for a long time to think of gender issues as being separate. But if we continue to focus on gendered perspectives and women's empowerment and really use this opportunity for discussions, whether in person or online as we are now, we can change the wordage and begin to get away from thinking of these issues as strictly those of women and realize that they are important to all. So I'll conclude my remarks there.
Thank you very much, Professor, for that presentation. We note that that the pandemic has exposed that gender and women issues are not simply women issues, but also a whole society issues. Now, for our second speaker, we have Dr. Alegra Wolter. Dr. Alegra Wolter is a medical doctor, diversity advocate, and chair of Suara Kita Advisory Board. She is the partnership manager at Doc Quidi Indonesia and general practitioner at Aksa Merah Clinic. With a passion for mental and sexual health, she works on programs and research projects dedicated to empowering marginalized communities, including people living with HIV/AIDS, people with mental illnesses, and gender and sexual minorities. Dr. Wolter, the floor is yours.
Thank you so much, Rocky. Allow me to share my screen. Yes, good morning, good afternoon, and good evening to everyone. Thank you so much for the panelists and also the committees. Today, I would like to present on how this COVID-19 pandemic is exacerbating gender inequality and also the impact specifically to transgender and gender non-conforming communities, and what are the recommendations and lessons that we can learn on gender inclusivity. So I would like to start with the saying that COVID-19 affects everyone, but it does not affect us equally. In the gender inequality spectrum, we've seen a lot of challenges in the healthcare and well-being, especially in the sexual and reproductive health spectrum. And this could be worse in marginalized communities as well. And we've seen a double burden for women, as what Professor John have explained before. A lot of women engage in unpaid work, they do housework, they do childcare. And guess what? Around 76% of the women were working in the front line for the healthcare forces. We've seen increasing violence as well that is equivalent to global disaster, especially in the relational spectrum. We've seen a lot of economic disadvantages, especially for women. They were more likely to lose jobs because of the service-related industry during this pandemic. They were more likely to be less employed, and they were increasing global poverty rate for women to around 10%. In the political spectrum as well, there were lack of women in leadership positions, with 81% of COVID-19 initiatives were led by men, which is quite an irony, even though the best handling for COVID-19, especially the initial stages, were made by female-led nations. And specifically to transgender and gender non-conforming communities, we have what we call as legacy of adversities. We've seen a lot of challenges in the social economic spectrum, education, and also employment and healthcare disparity, including HIV and other physical and mental health challenges. And the core of all of these adversities came from pathologization, social rejection, and also criminalization and demonization. And of course, these were exacerbated by COVID-19. We've seen a lot of barriers in healthcare. In Indonesia itself, we've seen a lot of trans individuals who were lack of legal documentation, especially for trans women. Sometimes they left their homes when they were younger, so they don't have their ID card with them. And it's quite hard to access the legal documentation through the government settings because they often felt discriminated. And of course, this create barriers to insurance, healthcare access, and also vaccination itself. We've also seen delayed healthcare in all spectrums of health, including HIV. Around 23% people living with HIV lost access globally, and also transition-related care. And a lot of trans individuals, they work in non-formal sectors. So these were severely impacted by the pandemic itself. It created more economic challenges. And we've also seen increased violence in the Asia-Pacific and some parts of Middle East and also globally. For a lot of people, family is where they can feel protected, but for LGBT individuals, especially for trans individuals, sometimes this could mean diminished access to social support and network because they don't find it in their family. They used to find it in their community, and now they don't have it. And there's this interesting research by the Indonesian Transgender Network back in 2020. We've seen loss of income to more than 50%. And even though a lot of trans individuals receive COVID-19 relief support, only 27% come from the government. The rest came from the organizations and also NGOs who are partnering with multiple national and regional organizations. We've also seen discrimination when it comes to receiving this COVID-19 relief support due to their identity and also lack of formal documentations. We've also seen violence that happen not only from the general population, but also from the security forces, from the government sectors. And there's this normalized violence. So a lot of trans individuals were hesitant to go to the police officer, let's say, to report these cases. We've seen improved HIV care. We were being included in the national spectrum of HIV care, but we've seen a lot of lack in mental health services and also transition-related care. And the research is in line with the research from Indonesia Positive Network. For more than 50% people living with HIV receive severe impacts, including trans women. And around 640 trans people, at least in Greater Jakarta, have lost their jobs. Around these adversities, we've also seen adaptability and also community resilience. The first example would come from the legal and civil support. The project that Suara Kita has with the support from the Directorate General of Population and Civil Registration, Ministry of Home Affairs. We do our best to facilitate trans individuals to receive their legal ID card, family card, and birth certificate, which is a very good initiative. It's been done before in the previous years, but it didn't came up with any good solutions until now, until this pandemic came. And also we've seen community adaptability as well. A lot of collaboration with vaccination committees without using the ID card, so they can access vaccination easily. And also online social support groups and other resources, webinars like this, and also other educational initiatives as well. For the community support, we've received a lot of charity works and also donations that come in the form of food and hygiene packages, let's say. And the largest donation will probably come from the crisis response mechanism fronted by the 5 organizations here in Indonesia with the target for LGBT individuals. We also receive regional support as well. One of the example is from the Asia-Pacific Transgender Network. 2 organizations received that, the Indonesia Transgender Network and also Sri Kandi Sejati Foundation. This is the picture in the regional in Thailand. But then again, for how long? Because this is not thriving, but we are trying to survive. So what can we learn from this gender inclusivity, and what are the recommendations that we can have? So first of all, we need to learn that gender inequality has cost us. According to the World Bank in 2018, it cost us around 160 trillion globally, US dollars globally, in human capital resources in 141 countries, if we assume that women make as much as men. And if we want to trace down to where this gender inequality came from, actually it came from early age, when we were younger, when we were in our adolescent years. There's this myth, belief, and expectations that girls were more vulnerable and boys are strong. So we need to protect girls, boys were the trouble. And of course, this create consequences for girls and also boys. For girls, we've seen a lot of child marriage, early school leaving, pregnancy, HIV, STIs, violence, and also depression. For boys, they were more likely to become the victims of physical violence, died from unintentional injuries, prone to substance abuse and suicide, and lower life expectancy than women. And there's what we call as hidden depression in men, where we've seen a lot of symptoms in avoidance, numbing, escaping behaviors that translates as a lot of emotional suppression that could translate as aggression, violence, and even suicide. And in these 15 research streams in 5 continents, they found that boys, girls, and parents, they were aware of their gender non-conforming peers. But this GNC population were being pressured to conform, and they were less tolerant to them. And there's this interesting analysis from the Williams Institute, UCLA, that Indonesia has lost around 900 million to 12 billion US dollars when it comes to LGBT discrimination. And the discrimination can happen in all aspects of life, in education, economy, health, and so on, with trans women being the most visible target for violence and injustice. Even though there's actual pathway that in LGBT inclusion can also support economic development and vice versa in terms of human capital, economic potential, and achievement of capability. And there's this understanding that in a more developed country, they were focused on individuality and diversity. They were focused on individuals to become the best version of themselves, while in other countries, they are more focused in survival and less tolerance. So what are the recommendations that we can learn to handle this pandemic response? First of all, we need to realize that and challenge the binary system, because gender inequality needs collaborative efforts. It's not women's issue. It's not only minority issue. It is everyone's issue. And also we need to encourage participation for a lot of trans communities, and also practice non-discriminative efforts as well. We need to include trans communities in national and international programs. We need to something that translates beyond theory into practice, that is reflected in national and social values as well. In the policy level, we need trans-inclusive policies, training, and also research. And also we need to adapt the intersectional lens to address the systemic inequalities. We need empowerment programs that translates beyond HIV itself. We need something short-term and long-term. Short-term, for example, like community initiatives, Indonesian charity, online events, emerging business creatives, we need to support that. But for long-term, we need to increase the participation and also address the structural stigma, discrimination, and violence against trans community. So we can have equal access to education, work, health, legal protection, and other aspects of life. And there's this untapped potential for technology to support trans well-being in telemedicine, education, and other supporting platforms. These were the example of empowerment programs that we can do in Indonesia. We have the support from the International Labour Organization around a few years ago in entrepreneurship training, and also this is initiated by the HIV Research Center at Majaya Catholic University of Indonesia. We have reflective practice and also professional vocational trainings. We need something sustainable, long-term, and collaborated multi-sectorally that translates beyond HIV. Thank you so much.
Thank you very much, Dr. Wolter. The presentation has showcased how the pandemic exacerbated gender inequity, in particular for those with marginalized identities, for example, transgender and non-binary individuals. Before we go on into our third speaker, I would like to remind participants that you are welcome to raise your question, to raise your virtual hand and submit questions in the Q&A box. Now, last but not least, our third speaker, Ms. Anindya Restuviani. She is an Indonesian feminist activist advocating for diverse feminist issues in Indonesia. She was recently spotlighted as 40 women leaders in gender lens investing from UN Women Indonesia. Through her role as program director for Jakarta Feminist Association, Ms. Restuviani helps to provide safe spaces for women and gender minority in Indonesia to discuss gender difficulties that they face. Ms. Restuviani has also coordinated Women's March Jakarta since 2017 as the co-director of Hollaback Jakarta, a movement that seeks to end harassment in public spaces. Ms. Restuviani has helped to develop a website for people to share and discuss stories of harassment. She has also created an online module for bystander intervention training. Ms. Restuviani has been involved in influencing policy and legal reform regarding sexual and reproductive rights in Indonesia. She has been part of a team who worked in advocating the legalization of anti-sexual violence bill in Indonesia. Through her work, Ms. Restuviani is promoting people to become more active participants in the struggle towards gender equality in Indonesia. Ms. Restuviani, the floor is yours.
Thank you so much, Rocky, for the introductions. Good morning and good evening, everyone. As it was being introduced, my name is Vivi. I am currently work as the program director of Perkumpulan Lintas Feminist Jakarta, or everybody may know it as Jakarta Feminist, who are the initiators of Women's March Jakarta and also Feminist Festival. But we do more than that, to be honest. And today I'm going to present what we are actually doing during the COVID-19 pandemic in support of women and also vulnerable groups in Indonesia. So let me share my screen and just start my presentation for today. So as I mentioned today, I would like to talk more about our research that we did in 2020 during the first years of the global COVID-19 pandemic. But we are trying to focus more on what is actually the situations of gender-based violence that is happening in Indonesia. But before we go further on what is actually going on in Indonesia during the COVID-19 pandemic, let me give you a little bit of context on what is actually going on in terms of gender-based violence in Indonesia before COVID-19. So it actually already has a very high number in itself. Komnas Perempuan, or the National Commissions of Violence Against Women itself, reported 792% increases on the gender-based violence cases reported to their institutions. And with the gender-based violence in terms of an online setting itself has been increasing since the first report, which was in 2015, if I'm not mistaken, and in 2019 alone there are 184 cases being reported. So during the first the first years of the global pandemic, a lot of human rights activists, especially the feminist activists in Indonesia, are already worried with the situation and looking at how the government responds to the COVID-19 definitely do not have the gender and the gender perspective into it. So we observe that there are so many challenges in terms of even going to the safe house that temporarily being closed, or reporting to the police that has not very adaptive to the situation in itself. So it kind of create more challenges. So we decided to create some kind of survey that we did to 352 survivors of gender-based violence all around Indonesia and 25 provinces. And we do focus group discussions with the members of service providers in Indonesia to also map the situation in itself. So our reports find that with those 352 of the survivors of gender-based violence in Indonesia, 22% of them actually mentioned that during the pandemic was actually the first time they experienced gender-based violence itself. So there are definitely a very increasing, numbers of people who never experienced violence before, but during the pandemic, this is the first time they experienced violence. And in terms of types of gender-based violence itself, we see that the majority of the types itself are verbal violence, psychological violence, sexual violence, online-based violence, physical violence, and economic violence itself. That it actually very in line with many reports that is being published by many service providers, including legal aids. Komnas Perempuan itself mentioned that domestic violence, online-based violence, and dating violence are the top 3 highest numbers of cases being reported to Komnas Perempuan and also LBH Apik, which is one of the legal aid in Indonesia. In terms of location, we can see that public space, despite of the situation, the physical distancing or the social distancing itself, a lot of people has ideas that harassment in public space will be decreasing, but unfortunately that's not the case. We can see that public spaces such as public transportations, office or working space, educational institution, even health facilities, sexual harassment are still happening in this public space. The online space itself, including social media, has broadened the definitions of public space, where 38% of our respondents also mentioned that social media is one of the places that most harassment are actually occurred. And one of the other things that we found it quite interesting during our survey is that we found that 81% of the respondents who are for the first time experienced violence during the pandemic, they mentioned that they also experienced decreasing in terms of family income. So we can see that there is a big interlining between economical situation during the pandemic itself with the gender-based violence that is happening in Indonesia. And we also found out that 50% of the respondents who experienced gender-based violence during pandemic shared their story to other persons. It means that not all of them are actually comfortable to share it to other person, let alone reporting the cases to the legal enforcement or any authority. And which just shows that only 7% of the respondent who experienced gender-based violence in Indonesia actually able to report to the police. And based on the national reports of Komnas Perempuan itself, the numbers of cases being reported from 2019 to 2020 actually is decreasing. In 2020, we have more than 400,000 cases actually being reported to Komnas Perempuan, to police, to many other legal aids around Indonesia, but during pandemic, there's only almost 300,000. So it actually contributed with a lot of factors, including the way that the legal enforcement itself is not ready to adapt with the situation. And there are many other reasons, including, they cannot go out and there's no online services that is being actually provided by the authority to accommodate the way that it actually can be reported. And only 48% of the respondents actually know the information on service providers in Indonesia. So other than the other reasons that I already mentioned, actually the lack of information on where and how to report when they actually experience gender-based violence, or when they witness gender-based violence itself, contributes to the lack of the case being reported in Indonesia. With the service provider itself, we see that based on the survey, 8 out of 12 respondents who worked as service provider mentioned that the numbers of reports to their institution significantly increases during the COVID-19. And 60% of them mentions that they are actually experiencing many difficulties, including financial support and personal protections equipment to support their field work. But despite of this limitation, the respondent who experienced gender-based violence mentions that the majority of them feels that the reports are actually being processed relatively fast, which is within 7 days by the service providers itself. So based on those findings that we found, and especially the finding that we found during the on the information's part, on the lack of information's part, Jakarta Feminist actually created digital-based interventions to combat gender-based violence in Indonesia. We call it carilayanan.com. This is actually a directory website that provides curated and also up-to-date list of service providers all around Indonesia. We have more than 100 of service providers that is being listed in this website directory, where the service providers actually can be found through the types of service and also location filter. So you can go to the website and you can find the service provider that you need based on what kind of service that you need and where you are actually located in. And the aim of the service itself is to provide easy and safe access of information related to service providers in Indonesia for those who experience gender-based violence, their family or their friends, and also general public. And we try our best to make this website directory as safe as possible. So we created a masked address in order to avoid if you live with the perpetrators and the perpetrators are going to browse through your history. So we have a masked address that will directly link to Cari Layanan, which is called belipotbunga.com. So instead of when they are looking at your browser history, instead of they are knowing that you are actually looking for service, they will only think that you are trying to buy a flower pot, so flower face. So like that's how we are trying to create a safe channel and platform for people to be able to browse through information or where they can find service providers that help them through GBV situation. And with this Cari Layanan itself, in every page you can see the quick exit button or keluar cepat in bahasa Indonesia, which with the keluar cepat itself will be following you to every page. So in terms of when you feel like you are in danger, when you are looking when you are browsing through the website, you can just click the keluar cepat and you will be directed to youtube.com. So just to make you safe. And the carilayanan.com itself, we do not collect data. So you will be directly linked to the service provider that is listed on the website itself. And when you're searching or browsing through the website, this is what you can see. So the search result will show a list and map view. So you can see this is I put on a national search a location, and you can see there is Bali, and then there is in Indonesia and the national level itself, and you can see the map view as well to make sure that also there are many other locations throughout Indonesia, or the exact location or where the service providers are actually located. And it will be provided with short descriptions on what they are actually doing. For this, you can see one of our partner, which is the LBH Apik Sulawesi Selatan in South Sulawesi, and also we also provide other information, including the location itself, the opening hours, contact or hotline, website, social media, etc., and especially where you can actually contact them to find help. We also develop Twitter bot that will automatically respond to direct messages and or mentions. During the global COVID-19 pandemic, we see a very increasing numbers of people actually speaking up through social media in order for them to find help. So we decided to also put this to social media instead of creating another application, which is easier because there are so many young people in Indonesia actually use social media. So right now we have the Twitter bot that will automatically respond to DM on Cari Layanan and also Jakarta Feminist Twitter account, and or mentioning us on Twitter. But we also are currently developing a more advanced Autobot on Twitter and also Facebook Messenger. So currently it's only if you mention us, then you can get respond. But the more advanced, you don't have to mention us. As long as you have the key words to the situation, then we will automatically respond. So other than that, we are also do a fundraising for vulnerable groups of women affected by COVID that we did since last year, which last year we raised almost 60 million rupiah that we distributed more than 250 individuals, including trans women, service providers, those who experience gender-based violence, women and children as asylum seekers. And right now, since July 2021, we have raised more than 170 million rupiah and distributed to almost 1,000 individuals all around Indonesia. So if you want to learn more about our work, so please visit our website at jakartafeminist.com, charilayanan.com, and also we have our Instagram itself, and you can always reach out to us through our email at info@jakartafeminist.com or to me at vivi@jakartafeminist.com. That's it. Terima kasih.
Thank you very much, Fifi, for your presentation on your activism work and the findings on gender-based violence in Indonesia during COVID-19 pandemic. That concludes our presentation by our esteemed panelists. I would like to remind participants that you may access the live interpretation feature using the globe icon located in the bottom right portion of your Zoom window. For our Q&A, participants are also welcome to raise their virtual hand or submit questions in the Q&A box. Now, first, we have a first question from YouTube, from Salman Lukmansyah. I think this question goes for all three panelists. Is there any positive lesson learned on the initiatives both in the US and Indonesia to reduce domestic violence during the pandemic, aside from police intervention? In the order of the presentation, I would first like to invite Professor Johnson Fries to answer the question. The floor is yours, Professor.
Thank you very much. I thought our last presentation addressed that beautifully. It was enlightening for me and heartening to hear all the very creative things that are being done in Indonesia to make sure that those suffering from domestic violence have a source of information. And I think from my experience and my research, what we've learned is that providers need to be more creative, need to find more ways to reach out. And the importance, one of the things that COVID has done is allow abusers to isolate their victim more because of lockdowns and because of people staying in. And the importance of reaching out, of being proactive, to keep in contact with others. If you think there might be any possibility that someone is in a difficult situation, reach out on, be it telephone, on the internet, but to stay in contact with people, to let people know that there are people watching and there are people concerned. So I will leave it to the practitioners at that, but it's a great question.
Thank you, Professor. Next, perhaps Dr. Wolter would like to add some points, or?
I would like to answer from the gender minority perspectives. When it comes to domestic violence, we've seen this happening, but a lot of trans individuals, they prefer to not report that in the personal spectrum, especially in the relationship and also family dynamics. But I would like to highlight the fact that we also have community level of violence. I think last year there's trans women who were being burned alive here in Jakarta because she was being accused of stealing a wallet from a bandit or someone in her working environment. She was burned alive, and of course this creates a lot of anger from the community. We have to advocate for the police officers and also for the media to highlight this. And also last year, there's also this YouTuber who give prank to trans women. They were being given donation boxes, but it was filled with rocks. So it also creates the fact that there is this influence from the social media spectrum as well. So a lot of people were coming out to advocate and also speaking up towards the inequality that happened for transgender and non-binary communities here in Indonesia. And I think that's a good initiative because we rarely see them before prior to this pandemic. Some sort of community outrage that happened towards gender minorities, but we've seen them now. So I think I would love to highlight that.
Thank you, Dr. Wolter. Next, Ms. Fifi.
Yeah, thank you so much. That is actually a very good question. On the police intervention itself, unfortunately in Indonesia, we do not have much police interventions in terms of when we're talking about gender-based violence. In a sense, there are so many distrusts in terms of the police intervention itself because of because of the histories of how things has been going on during us filing reports, especially in Indonesia. Currently, we do not have law that actually define more types of gender-based violence in Indonesia. Right now, we only have 2 types of gender-based violence or sexual violence actually that is actually being regulated in our law, which is rape and, if I'm not mistaken, I forgot one of the other one, but it's just rape and mostly our physical with physical type of sexual violence. So it's kind of hard for many victims of gender-based violence in Indonesia, especially the online gender-based violence itself, because we have many others law that tend to criminalize the victims of online gender-based violence, such as the pornography law and also the ITE law. So the police interventions most of the time is actually being avoided because they are very much non-accommodative to the situation that is happening in Indonesia. So however, we've seen a lot of community working together to be able to to fulfill the rights of the victims of gender-based violence, such as things that Alegra with Suara Kita has been doing. That's the things that have been done by Jakarta Feminist itself and many other service providers in Indonesia. And as our as our reports found that despite of this very limited situation, somehow the service provider are still very much helpful. The majority of the people who are actually reporting their cases to service providers say that they respond very fast and everything. So one of the things that we are trying to do with CariLayanan.com, with the Twitter bot itself, is the way that we are trying to innovate on how we are actually able to intervene when we actually see harassment happen. Most of the time right now, we are waiting for people to report. But right now we are trying to kind of like pick up a report that is being shown on social media, things that they are actually talking about on social media. And we are the one who's trying to kind of, hey, there are actually service providers that can help you. So if you are actually in this situation, or if you know someone in this situation, you can find the service providers that you need throughout this list. So this is what we are trying to help. But of course, we are trying to increase more skills in terms of the capacity buildings of many service providers in Indonesia. That's why the CariLayanan.com itself, we actually partner with 5 legal aid, which is 5 LBH API throughout Indonesia, which is in Jakarta, in Sumatra, in North Sumatra, in Medan, in Jakarta, in Semarang, in Central Java, and also in Kupang, and also in Makassar. So there are 5 of them who are actually working together with CariLayanan.com. It's basically to pick up, instead of us waiting people to report, we are trying to actually pick up cases that are actually being shared on social media. So yeah, I hope that answered the question.
Thank you, Fifi. Thank you for also bringing up the infamous anti-pornography bill and the infamous UITE, Internet Electronic Transaction and Information Law, which have been used in the past and currently ongoingly to actually enact more gender-based violence towards minorities in Indonesia. Our second question, I would like to sum up the question probably. This is for Professor Jonathan Fries regarding the condition in the US. There's a curiosity whether there's a change in the condition for gender minorities in the United States, given the change of national leader from President Trump to President Biden. And secondly, for Dr. Jonathan Fries, to what extent has gender equality has been integrated in the American COVID-19 domestic and international responses to the pandemic? Dr. Jonathan Fries, the floor is yours.
Thank you very much for those 2 very, very important and very difficult questions. I think in the United States, we're very fortunate that many of our structural barriers to gender equality have been addressed. Some of them until not very recently, but over the years, and of course in the United States, Ruth Bader Ginsburg was a pioneer as an attorney and then on the Supreme Court in bringing down structural barriers, laws and policies that really inhibited gender equality. But the cultural barriers are still strong in many areas. And I think there was a concern among many women that was certainly evidenced in the 2017 march in Washington, that women's rights were going to, and minority rights generally, were going to be rolled back. And that spurred several responses. One, the number of women politicians has risen significantly at the state and the community, state, and national level. So more women are getting involved. And we know that when more women are involved, several things change. Communications, women communicate differently. We ask questions, we try to build consensus. We bring up issues that are often forgotten by male politicians, again, because they are very often categorized as women's issues and they become bargaining chips. And third, women seek different kinds of problem solving. Women use different kinds of problem solving methods, more collaboration, more cooperation. It's nothing, or as opposed to viewing things as zero sum, I win, you lose. So I think there is more political involvement. Beyond that, I think that the Biden administration is intent on a couple of things. One is to reconcile domestic and international policy, to not have a do as we say, not as we do kind of policy regarding minority rights of every variety. And I think second, we're trying to recognize that gender equality isn't something that we do over there, isn't something we try and get others to do, but it's something we have to do ourselves and to lead by example. So I think there's been a real positive change in not just rhetoric, but in action. And I think we're going to see more of that in the years to come. But certainly, there are still issues of gender equality and racial equality, minority equality overall that have to be addressed. But I think we are now acknowledging the problem. We're now trying to educate people about the problems. I work in the field of women, peace, and security. And just this year, for the first time, we are including discussion of that in our military schools. And I've said many, many, many times, you can't implement what you don't know about. So just awareness about gender inequality issues that are being faced not only in the United States, but around the world is a first step in addressing them. So I'm cautiously optimistic.
Thank you, Professor, for that cautious optimism. Now we have a question which I think goes for our Indonesian panelists. For context, there's a recent phenomenon of spilling in social media where people basically, to use the words of the kids these days, spill the tea, where it's actually happening, telling things that were used to be secret openly in social media, usually on Twitter or Instagram. So there's a question from our attendees, which asks whether this phenomenon of spilling of cases, especially violent cases, gender-based violence, especially, and in particular for people with marginalized identities in social media. This question is from Karen Mudianta. She wonders whether this spilling phenomenon is a solution or a further problem which might cause further violence for the people involved. Perhaps any of our Indonesian panelists would like to comment, perhaps Dr. Wolter or Dr. Fifi first.
Okay,
Fifi.
Okay. Yeah, I mean, I'm also like in a situation where I found it very dilemmatic every time I see someone actually quote unquote spilling their stories, their harassment story on social media. But on the other hand, we also understand the lack of, platform for people to be able to report their case, especially when our survey also find out less than 50% of these people actually knows the information on where to report. So there's like this two sides of the story itself. In the other hand, it is definitely create more vulnerability, especially for the victim itself, to not only be attacked online with the whole situation with Indonesian society, who are still have a big tendency to blaming the victim, and saying that, why don't you report to the police, despite we know that it's not as easy as it sounds, saying that just report to the police, or like, oh, because you were asking for it, and all of that kind of conversation are still happening in Indonesia. So in a sense, that there are a huge chance of increasing the vulnerability of this victims who are actually sharing their stories in social media. However, as someone who also experienced gender-based violence, knowing that I don't want to be policed as well on how myself reacting as the victims of gender-based violence. If I feel comfortable of sharing this on social media, then that's what you can do, and whatever your reasons of sharing it on social media is valid. What we can do as bystander, especially the one who actually witnessed the stories on social media, is to as best as we can to ensure a safe space for them, and to ensure that they are able to find helps that they need, including, if you know charilayanan.com, you can reply to their tweet, you can comment on their Instagram. I know we're sorry that this happened to you, please go to charilayanan.com to find resources where you can find help. So in order for us to police, why do you have to share it on social media? It's, in a sense, it's the same thing as we are actually blaming the victim itself for sharing it on social media, because maybe this is the only channel that they have to eventually find helps. On the other hand, I also see a lot of stories that is actually being shared on social media, not from the victim itself, but basically from the third party, their friends, their family, as actually quoting and spilling the stories on social media, which I find it very problematic. A lot of them are actually just trying to reach for a cloud, like instead of like making it as a content, without considering the safety of this people who are experiencing sexual harassment. They sometimes, like do not censor the name, or if they actually censor the name, they still left out so many details that are easily, like the internet sleuth right now, it's so easy for them to actually find a lot of detailed informations of someone. So there are a lot of vulnerability of it as being doxxed. They are being found out. The perpetrators actually figuring out who are the people who are actually talking about this case, and which is also increased the vulnerability of being attacked by the perpetrators itself. So I think if you are someone who knows someone who actually experienced gender-based violence, instead of spilling it on Instagram or on Twitter, I think what the best thing that you can do is just to encourage them to find information or where they can actually find help. So yeah.
And
thank
I
you,
will.
Fifi. Okay.
I would like to add few points. Thank you so much, Fifi, for the highlight. And I think when it comes to trauma, it can result in a lot of mental health spectrum in how people want to express themselves. And in terms of sharing experience online, I think if we can create some sort of highlight and also some sort of community understanding in domestic violence, in sexual violence, it can create a movement for our generation to become more sensitive towards sexual abuse and to the needs of sexual abuse survivors itself. And I think it's very important for us to highlight the fact that good what Fifi said before, that we don't need to police what people want to share in the social media, but what's more important as well is to address the needs of the survivors. in the psychological spectrum, especially what are the supports that they can have, what are the supports that they can receive from the government and also both private and public sector as well. And also, it's very important to highlight the fact that currently our government is still postponing the elimination of sexual violence bill, which is a huge deal, and it proves the lack of understanding and also the lack of empathy for our government towards our survivors.
Thank you, Dr. Wolter, and thank you, Ms. Fifi, for that conversation on the need to center the conversation on the victims themselves. Now, I think we have two general questions open to all the panelists. The first is from Dr. Alegra Wolter on whether there is a way for us to return to the post-pandemic world, which should have been more safe. The second question is on whether there are some lessons learned from domestic violence during COVID-19, in which cases the men and boys are the victims, and is there any policy so far to address the situation? First, perhaps I would like to go to Professor Johnson-Fries to take the first.
I will certainly comment on the first one. I don't think pre-COVID was safe. It was simply less violent. It was violent before, it's just more violent now. And I think, again, awareness is increased because it's become a problem, a broader problem that is touching more and more people. So whether we can return to a less violent world, I certainly hope so. And I think, again, once it's going to depend largely on if we get back to people having jobs, if we get away, the point has been made repeatedly of the connection between lack of employment and decrease in family income and violence. If we can get back on a road to economic growth, I think that will be one thing that will certainly help the situation. But we need to really get at the root causes of this violence, and I think that is both economic, it's cultural, it's societal, and it's something that perhaps COVID will bring to light in a way that will allow retrospective look in the years to come. The lessons learned, in working with women, peace, and security issues globally, certainly we learned from women in Northern Ireland, we learned from women in Sudan, we always have lessons learned. Unfortunately, it's often retrospective. So it's not doing us as much work, as much good as we wish right now. The other two remarkable panelists are trying to be innovative as they're operating, and I admire them for that. But I think it is something that we can only learn as we go.
Others, perhaps, Fifi, Dr. Wolter?
I would like to add to Professor John Johnson-Fries. I think when it comes to this domestic violence, there's an interesting research. I forgot where did I read that, but one of the biggest protective factor is for women to have jobs. So if they have secure jobs and secure income, they were less likely to receive any forms of violence, especially domestically. And I think we need to encourage more women and minorities in the workforce, in the economic spectrum. And this needs to be reflected in our policies, in childcare, let's say, and then the maternal leave, let's say, or paternal leave, even. But it is also, we need to understand that gender perspectives is also happening in the community and personal spectrum as well. Why men were not encouraged, or even they are not willing to participate participate as much as women in domestic work, in taking care of children. We need to address that as well, because gender is not only cultural, it's not only social and political, it is also psychological. It's how we were raised as children to act a certain way. So it is very important to address that as well. So it needs integrated collaborations from the larger spectrum in the government level, private sectors, and also community and personal family spectrum as well.
Vivi?
Thank you. Okay, before I answer the question, I think I kind of blanked a little bit. Did you ask the questions about the lesson learned from domestic violence, which men and boys as the victims as well? Did you ask that?
I asked both questions.
Okay, all right. So I'm just gonna answer the second question. I'm just not sure whether you asked it or I'm just reading it. Sorry. So yeah. So I'm just gonna answer the second question because I think the first question has been answered beautifully by Professor Fries and also Dr. Wolter. But in terms of the, again, like we don't want to deny that when we're talking about gender-based violence, we know that it's not only happening to women and girls. In 2018, actually, Jakarta Feminist and Jakarta did a big national survey when it was actually we collected 62,000 respondents throughout Indonesia. And the result of that survey on the sexual harassment in public space shows that 1 out of 10 men in Indonesia actually experience sexual violence in public space. So there are actually cases of this. Unfortunately, again, in Indonesia, with the lack of the law and the policy itself to define what is sexual harassment, as I mentioned, within our penal code, there are only definitions of rape itself and also, I think, molestation, which are very physical. And it's definitely, with the rape itself, the definition is penetration between vagina and also penis, and also always portraying the woman, the victims are women. So in a sense, so many men in Indonesia who actually experience sexual violence, especially when they are, when they are young, it's hard for them to actually find justice itself, because also the concept of the patriarchy that is it's still very rooted in Indonesia, also kind of hinder men to be able to express and also to speak up when they actually experience harassment. There are so many, a victim blaming situation as well, or considering that if men actually experience harassment, they should have enjoyed that. So that kind of concept and also normalizations of how sexual harassment are actually being portrayed also kind of contributes on why it is very hard for men and also especially boys experiencing sexual harassment to actually come up and eventually find helps. And that's why the anti-sexual violence draft bills needs to be ratified and legalized as soon as possible.
Thank you for all panelists on that question. Next, we have a question which if I may summarize, is basically the role of religion in politics on this. This is basically for our Indonesian panelists. The question is from Muti Anggita. How significant are the roles of religion, especially Islam, in supporting or hindering the progress towards gender equality in Indonesia or in other countries with big Muslim populations? Does religion hinder or support gender equality, and what can we do about it? And also, I would probably like to ask this question as well for Professor Dr. Fries, whether there's any role that Christianity as the majority religion in the US have any role to play in supporting or hindering the progress towards gender equality in America. But first, I invite our Indonesian panelists to have a go at this question.
Okay.
Wolter?
Yes, I would like to start with the understanding that in a lot of countries with a religious population, religion played a big role. So in terms of it is very important for us to find religious leaders who can interpret the verses in a very more diverse way, in a more loving way, so we can encourage and support women and minorities. And we already do that in a lot of webinars. We are collaborating with supportive priests and also the imams to, especially for gender and sexual minorities here in Indonesia, to promote acceptance, especially to the family member, because family played a huge role in LGBT acceptance, and also the overall healthcare and well-being for a lot of LGBT individuals in Indonesia. And religion is one of the most powerful factors, protective factors as well, could be, if we were able to tap into the more humanistic aspects of religion. And I think the goal is to encourage more of a social change in terms of our culture, and how we can be more accepting towards women's rights and also minority rights as well. Maybe Fifi would like to add?
Yeah, sure. Just to add a little bit from Dr. Wolter already mentioned, as someone who actually grew up in a very Muslim family, I never find Islam especially are actually hindering, but the conservatism itself was the one who's actually hindering the progress of gender equality. So I totally agree with what Dr. Wolter mentions. I think the way that many conservatism idea interpreting on how Islam itself in Indonesia, which I believe in the US probably conservatism would be, like believed by other religion aside of Islam. So I think that's the one that is hindering. So with our campaign and also advocacy right now, like what Alegra mentions, that we actually try to encourage more this religious leader as a champion to be able to translate a more gendered perspective in terms of religion itself. It's not only Islam, we also engage with many other religions in Indonesia, also with other what is it called, Panghayat, which is the traditional beliefs in Indonesia as well, to actually able to kind of see that gender equality is not something that, which is basically one of the big misconceptions in Indonesia, that gender equality or feminism, they believe it is not fit with our culture, when we actually, with the traditional beliefs itself and also the traditional culture in Indonesia, there are actually so many culture and also so many things that already translated gender equality at the very first place. So, yeah.
Professor Jonathan Fries, perhaps?
Well, I think to just add on to what the other panelists have said, I think within any religion, there is a spectrum of views. And on the conservative end, where there is more a hierarchical view, more reliance on literal interpretation of text, you find the more resistance sometimes to what are considered untraditional or too modern views of gender equality. But I think it's important to note, here in the United States, one of the largest religious groups, the Southern Baptists, are very much in, I don't know, turmoil might be too strong of a word, but they are having a great discussion within the group about the role of women. And one of the most popular, most listened to women's teachers. Women are not allowed to be preachers in that particular group, but teacher with millions of followers left, saying, I can't do this anymore. My religion is important to me, but the views that are being adopted, including regarding gender equality, just don't go along with my own beliefs. So I think there is very much needed discussion going on within that group. And I would like to see it in other groups. I hope to see it in other groups as well. To kind of relate this back to a previous question, even before COVID, there was a very concerning rollback in some laws in many countries concerning, for example, domestic violence, making it a family matter rather than a legal matter. And I think Sometimes religion plays into it, sometimes not. But I think, again, with more women becoming involved with politics, with more women speaking out, whether it's, I was interested learning the term spilling tonight, that women are no longer willing to be kept out of the discussion. And that will be true in religions as well as politics and other areas.
Thank you, Professor Johnson-Fries. We have enough time just for one more question. The question is from Raka Ardi Pamungkas. What can Indonesia and the US collaborate in advancing gender empowerment within the constraints of the pandemic? I would like to invite all three panelists to answer this question shortly. First, perhaps from Dr. Wolter.
Yes. Before I jump to that question, I would also like to highlight from the previous question that a lot of religious extremism in Indonesia is also politically driven. So it's not purely religious extremist driven, but we've also seen politicians using these groups as a tool to uplift their popular vote. And I think it is very important for us to continue educating our generations so we can become more aware towards these injustices. And also moving to the question and what we can do, there were a lot of things in terms of support that we have received from the US, for example, for vaccination and also other economic support as well. But it is very important for us to allow continuous efforts that is not 100% relied on programs or funding projects, but we need to have something long-term and sustainable for the empowerment of women and also minorities, and also include men in the conversation as well, because it is indeed we need more collaborative efforts that translates in practical ways. What are the things that we want to do? For example, we want to focus on health. We want to focus in encouraging participation of women and youth in politics, let's say, or even legal spectrum as well. So it is very important to keep the conversation open. And I've been very fortunate to see over the past few years, I think since the 2018, since the rollback of LGBT rights and also women's rights in Indonesia due to the moral panic, I've seen more community resilience and a lot of programs that were quite creative in terms of engaging towards the millennials and also the newer generations. And I think we need to encourage that participation of our youth because it will be key.
Thank you very much, Dr. Wolter. Vivi, shortly, perhaps.
Yeah, I think Alegra already kind of summarized a lot of what I'm going to say. But just to add a little bit, I think like I completely agree with everything that Dr. Wolter mentioned. But one of the things that we need to bear in mind every time we have like this kind of bilateral relationship, and especially with the context of Indonesia as the post-colonial country, is just to avoid the way that like when partnership coming in, and to avoid the way to see it in terms in a neo-colonial case, a lot of the support sometimes are are avoiding to listen what the locals are actually needs, in a sense that the support is itself become not sustainable. So in terms of just looking at it and on a very American centric ways, I hope that if there are partnerships that is going on, which I believe there are so many of them already going on, is just trying to understand what is actually the locals and especially the vulnerable groups in Indonesia actually can have the most benefit in terms of the sustainability itself in Indonesia, and the other way around as well. So thank you.
Thank you, Fifi. Professor Johnson-Fries, from you.
I think my two colleagues have really done a great job answering the question. I would just like to add that I've learned a lot tonight from the panelists, and I think that's important. We can learn from each other. It isn't a one-way conversation. And it's interesting, I think we have some common issues, not only in the kind of health, education, domestic violence, but how to get more men involved. We have the same problem in the United States. How to expand our constituency so that, how do we change the verbiage from women's issues to family issues? How do we make this the issues that we're all dealing with? How do we broaden them, and how do we build the kind of coalition where in Indonesia, in the United States, we can turn rhetoric into action?
Thank you, Professor. And with that, we conclude our panelist session and our Q&A session. I now turn the mic to our MC, Rob. The floor is yours. Back to you.
Thank you, Rocky, and thanks as always to our partners at CSIS. Thank you to all of our esteemed panelists. We've all learned a great deal from you tonight, and we'd like to thank all of our participants for tuning in and for sending us those questions, which we believe constitute a great first step toward understanding the benefits of equality for Indonesia, the United States, and the broader Indo-Pacific region. We hope you will continue to stay engaged with Pacific Forum programming, which you can find out more about at our website, www.pacforum.org. Now that all of our speakers have finished, we have a poll for our audience. Here are our questions. How do you think the COVID-19 pandemic has affected gender inequality and gender-based violence in the United States? Pandemic has made these issues worse. Pandemic has not had a significant impact. The pandemic has enabled greater gender equality and reduced gender-based violence, or unsure or undecided. For our second question, how do you think the COVID-19 pandemic, let's see here. All right. Anyway, in addition to that, we also would like to remind you of the post-event survey, which we'll share again in the chat box now. We would really appreciate it if you would take a few minutes to complete it and share your feedback. That should be showing up in your inbox now, in the chat now. I would also like to take this time to invite our listeners to please stay tuned for the final two events in the virtual forum series, Adapting to COVID-19, Indonesia, the United States, and the Indo-Pacific, still to come later in 2021. Now, let's read our poll results. Okay. Pandemic has made these issues worse, has come in at 85%. We have no respondents yet who have chosen that it has not made a significant impact or that it has enabled greater gender equality or gender-based violence, and 15% remain unsure. Okay, our second question was, how do you think the COVID-19 pandemic has affected? Okay, that's still the same question. All right, moving on. Okay, thank you once again to our speakers for joining us today, to our partners at CSIS and especially Rocky, and to the U.S. Embassy Jakarta for making